I think this talk is actually not just the last one in this group, but it's the last talk in the app, if you go look. So we're at the end of the day. My name is Jim Hollingshead. I work for a company called ResMed, and I'm here to tell you about how we've used data and connectivity to completely change the model of patient care in our industry over the last 3 years, which means that I'm going to talk about sleep, because what ResMed does is we're the world's leader in the manufacturing of medical devices for the treatment of sleep apnea. And we're at the end of the day, and I'm talking about sleep, and I'm going to try not to induce any of it, right? So we'll try to keep it lively. Let me just start by saying, how many of you are aware of sleep apnea? Right, so I would expect most of you to. Anybody here have sleep apnea? If you don't want to admit that, maybe you have a bed partner or a loved one who has sleep apnea, have direct experience with it at all? A couple, okay. So I want to show you what it looks like. It's a very prevalent disease. We think that something between 40 and 60 million Americans have sleep apnea that is severe enough to require treatment. But not a lot of people have experience with it. So this is actually a public domain video. It comes off of YouTube. This man's wife has apparently videotaped him so that she can convince him that he has sleep apnea, and this is what it looks like in the wild. So there he is. So what's going on for this poor guy is, as he's asleep, his airway is collapsing. Those of you, many of you are familiar with this. His airway is collapsing, and he cannot breathe, right? So his diaphragm is pulling against a closed tube. And that's creating all kinds of nasty effects. I mean, if you watch this video, you'll see that his wife ends it with, this is just an excerpt, but she ends it with this tagline, I want to breathe for him, don't you? Right? It's so uncomfortable to watch. This man, if you count it up, probably has 30 events an hour. So every 2 minutes, he's not breathing, and he's not breathing for about 30 seconds. It's uncomfortable to watch, but it's way worse what's actually happening to him. So as his diaphragm is sucking against a closed tube, he's facing real mechanical difficulties in his body, and he's getting a lot of chemical problems in his body. So mechanically what's going on is the diaphragm's pulling, creating a vacuum. The walls of his heart are being pulled apart. His blood pressure is going up. It's putting severe pressure on the capillary bodies, so his kidneys, his eyes are facing severe pressure. And then he's getting chemical signaling. The way he starts breathing again is without waking up, his body goes into fight or flight. So it gives him a shot of adrenaline, and that's how it opens his airway. But he's getting that 30 times, it depends on your severity. You get this, there are patients that do this 80 times an hour. So they're running from a tiger 80 times an hour while they're asleep. So the neurochemically is raising their blood pressure. It's putting pressure, chemical pressure on their heart. It's doing all kinds of nasty things to his system. And that's why sleep apnea has such strong comorbid relations with all the chronic diseases that drive cost in all of the advanced care systems in the world. So very high risk of stroke. Strong correlation with atrial fibrillation, with heart failure, with drug-resistant hypertension. As you're asleep, your hormonal balance, if you're going through sleep apnea, your hormonal balance does not come back to normal. And so you're not getting the appetite hormones that would tell you that you're full. So you're hungry all day long, so you tend to eat. And if you're trying to control your weight, it makes it harder for you to control your weight, and weight actually is a vicious circle for sleep apnea patients, as you can see with many of them, right? So this is a disease that is very prevalent. It's, I think, a massive public health problem, and it's still underdiagnosed. And so I just wanted to give you that context. You can understand there's millions of patients that need to be treated, and there are millions of patients who are treated. That's context point number one before we get into the real meat of what I'm here to talk about. Context point number two, how is it treated? Well, it's treated with something called CPAP, and this is a CPAP machine from 30 years ago, right? And you can see that this, if you look at this thing, it's kind of crazy. That's actually a big industrial Hitachi blower, and if you look right over here, you can see that's the mask. So CPAP is a blower that's connected to a hose that attaches to a mask that you're wearing a face. The mask has to be sealed, and what it does is it creates just enough pressure to keep your airway open when your airway is trying to collapse, right? And that way you can breathe normally. Now, in the old days, you can see the massive, ridiculous blower. This mask was adhered to the face with denture cream, if you can believe it, and people still wore these, and the reason they wore them is because roughly half of sleep apnea patients, of obstructive sleep apnea patients, feel an immediate clinical benefit. They feel a better quality of life as soon as they start therapy. They wake up the next day with one of those moments like you see in the antihistamine ad where everything's been fuzzy and suddenly it's all clear, right? So despite how cumbersome this is, patients still wore this. But the devices have come a long way over the last 30 years. This is a photo of Most recent platform, I've got a real one here for you. This is one of our FlowGen devices. You can see it's much smaller, it's much lighter, it has humidification, it's easy to use, et cetera. And this is our latest and smallest mask. This is called a nasal pillows mask. It just sits in your nose, has an elastic. Much, much easier to wear. So over the last 30 years or so, ResMed has made significant technology advances to make the therapy much less cumbersome for patients. And that's allowed for millions of patients to be treated all over the world, right? And there's been great growth in that. That's context point number 2. That's not what we're here to talk about. What we're here to talk about is what we've done over the last 3 years to completely change that care model. Because this therapy is very cumbersome for patients, although we can make it better. We've made it better all the time. It's very cumbersome for care providers. Right? This is a labor-intensive therapy area. And the care providers, in this case in the US, are called HMEs, or home medical equipment providers. There's sometimes called DMEs, durable medical equipment providers. There's about 6,000 of these providers across the country. They range in size from big national chains that have local branches to a small mom and pop that might just be in the community. Right? Their main business, these are the care providers who are delivering oxygen to patients' homes. And that's really mostly what they do, is they do oxygen therapy. And about 30 years ago, they started doing sleep therapy. And you know, it's in general, their therapy areas are very labor intensive. They're delivering equipment and they're getting patients set up and so on. And what happened over the last several years is, as sleep therapy grew, it's just grown like mad because there's a huge unmet medical need in this space, payers started to notice, right? And they started to put requirements on HMEs around sleep therapy. And so in the middle 2000s, Medicare in particular put in place a requirement for proof of compliance for a DME or an HME to get paid for providing the therapy. Now, if you think about it, there's not a lot of chronic diseases where you're required to show the patient is using therapy in order for you to get reimbursed. There are few. Sleep is one of them. So that's a big requirement. But if you picture the world of the HME, and this is why we needed connectivity and data, this is a complicated thing to set up. You've got a patient who goes through a big complicated diagnosis in a sleep lab. They show up, they have a prescription. The prescription is going to say they need a certain kind of flow, this is called a flow generator. They're going to need a certain kind of flow generator or a bi-level. They're going to need a certain kind of mask. There's multiple kinds of masks. There's going to be pressure settings on this device. Patient comes in and you have to choose the right mask. You have to get them comfortable. There's an incentive for you to keep them compliant because they're going to want more masks if they stay on therapy. So it's a little bit like being a shoe salesman on the one hand because you got to fit the right mask. You got to be a little bit like an IT consultant because you got to set the device up. You got to have a customer service. You know, remember the patient is flying in the dark. The patient didn't know they had the condition, right? Now they've been told they have to wear this thing every night, right? And they don't know if it's working because they're asleep. And so they often have a lot of questions, especially in the first week or 2 or 3 weeks of therapy. They're calling their provider all the time. It's heavy lifting. It's hard work for the HME to set these patients up. And then what happened was Medicare decided it wasn't enough to require proof of compliance, but they would run a reimbursement cutting program that they call competitive bidding. And since about 2012, really starting in 2014, reimbursement for this therapy has been cut in half by Medicare, right? Which has also had a big effect on how commercial payers see this space. And so these are all the steps, and I'm not going to bore you with all of this, but these are all the steps that an HME has to go through to set up a patient on sleep therapy, document the patient is using it, and ultimately get paid by Medicare. This I don't even know if we show audits here. That's another big problem here. Very heavy lifting, and what Medicare has done is they've raised requirements and they've cut payment, right? And I'm going to come back in a couple minutes to how that's very similar, I think, across all of healthcare at the moment and what's going on. So this has created a huge problem for our industry. Higher requirements, lower pay. It's brutal for our customers, the HMEs. It's created a lot of pressure for us because we're now in a down price environment pretty aggressively, right? It's putting pressure on growth in our market, it's putting pressure on pricing in our market, and ultimately it's really bad for patients because it's much less likely in that environment that patients will find care. But these are patients who create all kinds of costs for the healthcare system. They need to be found, they need to be treated. We're absolutely convinced that finding and treating these patients pays back. So what have we done about it? Well, fortunately for us, we saw this coming. And about 4 years ago, we sat down and we said, where is our industry going to go? And we took into account what Medicare was going to do with competitive bidding, and we took into account something that I haven't talked about and I don't have time to go into, which is what commercial payers are doing with prior authorization on diagnosis. And we said we have two options. One option would be to dumb down the therapy, take all the cost of goods sold out of the device, right? So make a really dumb device, get the cost out of it, and go for volume. compete on the cost of the device and go for volume. A lot of medical devices companies have been forced into that situation over the last decade, right? And we had an advantage there because for us, we're a very high scale manufacturer. We're the leader in the space. We're the largest company in the industry. We figured we could have a manufacturing advantage and a COGS advantage, but we decided it was a bad idea. First, we thought it would put the whole industry on a slippery slope, which we didn't like. But most importantly, we thought it would be much less likely still that patients would get therapy, because patients would have a bad experience of therapy, they wouldn't adhere, and payers would come to see this all as a game, right? They would be shipping CPAPs out, patients would not be adherent, they wouldn't get the long-term benefit of therapy, and ultimately be a really bad play for the entire industry and for those millions of patients who need care. That was option one. Option two was we thought we can add value to the whole system. And what we'll do is we'll put a cell chip on every device, and we'll pull data off of that device every day. Now that was a big bet because it costs a lot of money to put a cell chip on every device. It's a high COGS item for us, and it means we have to have, we have to pay for the connectivity and do all these other, build out a network, build out software, but that was what we decided to do. And so a few years ago, in August of 2014, we launched this device, and this is not plugged in, but if it were, you could see it has the bars of cell. When you turn it on, it connects directly to the cloud. The patient doesn't have to do anything, the HME doesn't have to do anything. Every morning when the patient turns off their therapy, the device senses that it's no longer being used, and it sends that night's therapy data into the cloud. On top of that, what we did was we launched a whole suite of software as a service offerings, mostly aimed at our HME customers. And so automated compliance offerings, right? Automated billing offerings and other things like that, where we have a whole SaaS suite that allows our customers to run their businesses much more efficiently, and it gets them out of this experience, which is what they're in right now. For them, the world feels like this. And so we've launched this suite of software offerings. The other software offering we've launched is a patient engagement tool. So the same data that comes off of this device every morning goes up into the cloud, and it goes into a patient application called myAir. And remember, this patient has been flying in the dark. They didn't know they had the problem. They don't know what's going on with therapy because they're asleep. And now, every morning, they can go into their app and they can look at the results of their therapy. And we give their therapy a score. It's a little bit of gamification. And they can see how many hours did I sleep on therapy and use it? Did my mask leak or not? Other factors that go to a good night's sleep on the therapy. And if they're having an issue, the application will offer them a contextualized video. So if the app knows that they're wearing this mask and they had a mask leak, what it'll say is, hey, you had a high mask leak. Would you like to see a video on how to fit your mask? All of it's based on cognitive behavioral therapy ideas, and it's been very, very successful. So what's been the impact of that kind of platform? This is a screenshot of the compliance management suite that we have for our customers. And on this shot, what they're doing is they're looking at patients grouped by exception. So this cloud-based platform doesn't pull up the patients that are having no problem. It lets them be compliant. It actually communicates with them automatically and coaches them to compliance without a phone call. The only patients that show up in these boxes are patients that need some sort of action by the therapist. And so here you can see in the green boxes, this patient has proven compliance. If I click through here, I can bill. I can go ahead and bill an invoice for these patients. Up here in the upper left box that says compliance risk, there are 11 patients that have some sort of compliance risk. And if I click through there, it will show me what their problem is. Right? So it allows them to dramatically reduce the labor associated with treating these patients. It allows them to take action right within their business flow. And with this, it also increases compliance. And so this is a randomized controlled trial that we ran a couple of years ago with one of our providers. And you can see using that platform that manages by exception, automatically messages patients, and allows the provider to only call the patients that have problems, we raised adherence from 73 to 83%, and this is a provider actually has 73 is a pretty high adherence on this, right? We raised it to 83%, but we cut labor for them by almost 60%, right? Cut their costs, raised adherence. They get paid more by Medicare when the patient is adherent, so it raised their revenue, right? This is really a fundamental change in how they're doing business, right? So it's been great for our customers, and as you might imagine, it's therefore been pretty good for our business. And just to give you a sense, these are all sorts of stats that come out of our investors presentation. I'm not here to pitch you on the stock or on the therapy, but just to give you a sense of the scale of this sort of thing, we have more than 3 million patients now who are in our software platform. We have 2 million patients who are on this cell-based platform, more than 2 million who are monitored every night. which actually has made us the world's largest provider of overnight patient monitoring. We've blown through, we actually have crossed over Medtronic. We're a mid-cap company. This has grown dramatically. We have a diagnostic test that goes up into the cloud and links to the patient's record. We have 60,000 user accounts. This has grown from nothing over the last 3 years. And this one's an interesting one because there's a lot of talk about interoperability right now with data systems and so on. We've built out a very flexible API for our software platform. And so a lot of our customers are not logging into our system. What they're doing is logging into their fundamental system. So they may have some sort of billing system environment that they're working in, which is another third party, and they're calling our data through that other provider. We have 15 API calls per second out of our integrations. It's remarkable. And then, so for our business, it's allowed us to grow in a tough environment, and it's dramatically changed the way we see what we're doing. We've seen ourselves as a chronic disease management company for a long time, but we can really see now how we can use data and connectivity in other therapy areas like COPD, which is something we're working on. But for patients, it's also made a huge difference. So we've crossed over a threshold where 1,000 patients a day sign up for our myAir platform, right? That's enormous. And this is a screenshot of it. I've described it already, but you can see what they can do here is, this is, one morning shot. How did you do? You had 85 out of 100. Why? Well, you slept for 5.5 hours on therapy. Your mask fit is good, et cetera. And you can scroll through that and get tips and tricks and so on. And it allows the patient to no longer fly in the dark. They know if they're doing well in therapy or not. It also allows the patient to get their questions asked without calling the provider, right? Which is another cost saving for the provider. This platform has been so successful that if you take the HME compliance suite, in this space, the average adherence, which is actually really high, runs in the high 50s, right, for a CPAP patient. If you just took a national average, it'd be in the high 50s. If you have the HME apply our automatic messaging platform, the managed by exception platform, it gets adherence typically up into the middle 70s, right, which is well beyond any kind of oral drug, right, or other drugs. If the patient also opts into this, it's very typical for our adherence to get up into the middle 80s. It's extremely high adherence. It's been very successful, right? And so you can see 84% on this platform, 84% are compliant by day 90, which is the Medicare requirement. And it's fundamentally changed the patient's experience of therapy. And so it's actually been a win-win-win. It's been great for our customers who we sell to. It's been great for our company. It's been, most importantly, terrific for the patients. We get much higher adherence. They're going to enjoy the outcomes of having their therapy. They're going to prevent chronic disease. They're going to have a much higher quality of life, which is terrific. So where might this go, and why is this sort of a generalizable story? Well, what we're also doing with this data is we're doing API connections into hospital systems. We have a handful of those going. That's the next wave for us, is to connect into EMR systems and allow the patient record to be seen end to end. We now have, this is another bullet point I learned this week that blows my mind. We have 750 million nights of de-identified patient data. And with that data, we can look at the patterns of treatment with patients, and we can answer questions that we'd never be able to answer with randomized controlled trials. So we're about to publish, in the next month or so, we're going to publish a paper out of that data that's going to answer, and I won't go into the weeds, but it's going to answer a long-standing question about the other kind of sleep apnea, which is central sleep apnea, which is a chemical signaling issue, and the best way to treat those patients, out of all of that data. So we're going to be able to answer questions we've not answered before, right? And we're going to be able, using this end-to-end treatment, to prove to payers and to integrated systems that it does pay to find and treat these patients, which is still a controversial question for a lot of people. We have a number of pilots going with IDNs where they're managing these patients end-to-end, whether they're simple obstructive sleep apnea patients or other chronic diseases like COPD and heart failure. What's the lesson for healthcare broadly out of this? I think the lesson is data makes a huge difference, but it has to be applied in a relevant way, right? So there are a ton of companies out there, I'm sure there are a ton of companies here at the conference, starting up using data in specific therapy areas. We've heard a lot of that this week, and it's going on, things are springing up like mushrooms. The reason this has worked for us in the sleep space is because what we did was we solved the problem that was in front of us. We solved the pain points for our customers, right? And we drove adoption that way. We weren't shooting for the moon when we launched the platform. We simply wanted to make care more efficient and allow our customers to solve a lot of their labor intensity problems. We simply wanted to allow patients to understand their therapy better. And off of that platform, you can see we've had massive adoption. I think that if we can take it broadly as the healthcare system, whether we're device manufacturers, pharma manufacturers, hospital systems, physicians, other sites of care, and so on. If we can take that lesson and apply data and connectivity in a relevant way that solves immediate economic problems within the current payment systems, we can then bridge off of that. And I do think there's just fundamental, enormous promise for the use of data as we manage healthcare, improve outcomes, and lower costs. And I think with that, I have a couple of minutes for questions. Yes. Yeah, that's an excellent question. The first week of therapy is really important, as you know, I think you're referring to. There are ways to re-engage the patient. It's usually going to be through their provider, right? So if they've fallen out, now one of the things you can do is off of the platform we have is we can monitor those patients long term, and if that device is not sending data at all, it will prompt the provider to call them, right? And we've worked with a number of HME clients to create a program where they, a rescue program where say, hey, that patient went on, it used to be that would just be ignored, right? Or the HME might decide, I got to go get that device back so I can clean it and put it on another patient. Now, more and more what we're seeing is because of the ability to monitor long term, for a couple of years, we can reach out to those patients. Actually, we don't do it. Our customers do it. They reach out to the patients, get them back in therapy. And there are also other modes of therapy that people can use. So sometimes a patient will fall out of therapy because they just can't tolerate it. That's fairly typical, right? And for a patient like that, they might try an oral device or some other form of therapy. Sometimes a patient will fall out of therapy because they actually have a misdiagnosed condition. So they might also have COPD, which hasn't been caught, or they might also have central sleep apnea, and there's therapy-induced central sleep apnea. Our devices actually pick up central sleep apnea, and so it can give an alert and say these patients actually have a high degree of central events, and you should bring them back to their sleep doctor. So that's another benefit of the monitoring. It's not perfect, but it's an improvement.
So one question I had was, so have you done any analysis of actually taking the data that you're collecting to longitudinal outcomes and seeing how usage of the machines will address some of the risks that you were talking about earlier?
Yes. Yeah, we're working on that right now. I mean, I think this creates a huge opportunity to do that, and we're in conversations right now with, and I won't name them because they're all under NDA, but there are a couple of large healthcare data companies we're working with, and there's a handful of integrated delivery networks that we're working with to measure that risk and try to understand, for example, not just the benefits of therapy, but is there a dose response to therapy? Because the compliance level that was set years ago at 4 hours a night is an arbitrary number that was pulled out of the air at the time, right? So what nightly dose would be truly beneficial, and what period of therapy, and is it actually a preventative therapy? We know anecdotally, I think from our own experience, that it is, but we have to have claims data to document it. And so this is going to make that much more achievable.